So this is a thoracic vertebrae. How do we know this is a thoracic vertebrae? Anybody know? I can see the chat, but I can't. I have my close-up glasses, so everything's all blurry over there. The spinous process. Look at how the spinous process goes straight down. Watch, let me grab a... Yeah, we kind of did this in the first lecture. So here's the lumbar vertebrae. See how the spinous process goes straight back? So specifically, we know this is a mid-thoracic vertebrae because the ones toward the top, they look more like cervical. The ones down below, I'll show you T12 here in a second. They look more like lumbar vertebrae, but these are there's nothing else that looks like this. So that's a thoracic, probably a T7, I would say. And we can see a couple things. Let me try to zoom in on this, and we'll see how this goes. I don't know if you could see this or not, but there's, see that right there? So that's a facet. Specifically, it's a costal facet. Even more specifically, it's an inferior costal demifacet. And whenever you see two of them, see here's another one right there. And those are where the rib articulates with the vertebral body. Whenever you see two of them like that, you call them a demifacet because they're small and there's two of them. If you don't see, if there's only one of them, and there wouldn't be one right here, if there's one big one here, that's just called a costal facet. Like T12 and 11 have a costal facet. So yeah, that's what they are, the costal demifacets. If I spin this a little bit, we can also see another one right here, quite a big one. I don't know if that's going to get in focus or not. There we go. But see how smooth it is? You can't feel it, but I can feel it, and it's smooth. So that's a costal transverse facet, and that's where it articulates. Here's the key, with the same level rib. So if this is T7, we know that the T7 rib also articulates with that. We also know the T7 rib articulates with which one of these do you think? I always say superior demifacet, costal demifacet here. Superior, S stands for same. That's how I remember it, same. So the same rib. So if this is T6, the rib that connects to this one is also the T6 rib. Okay, so those costal demifacets. The superior one always tells you what rib, and it makes sense, right? Because it's right across from this one, so the rib couldn't dive all the way down here. It'd be a crazy angle on the rib. All right, so that was kind of the star of show today. You can see the huge vertebral notch, right? A huge vertebral notch. And then if we look up at the top here, there's nothing. So that's really strange that there's no vertebral notch. There's no superior vertebral notch, just a gigantic inferior vertebral notch. And what else can we go over? So this, if we turn it this way, these are the Z joints. Let's check these out. So again, you can't see them, but they're really smooth to the touch. And they're flat, both of these. So these are the facets of the superior articular processes. The facets of the superior articular processes. If we spun the vertebrae like this, kind of for an A to P view, you can still see them sticking up, but these are no longer facets, right? They're just a kind of a more rough surface. So if I had a little clay blob on there, or a sticker number 2, that would just be the superior articular process. Superior articular process. All right? What about the inferior articular process? Let me tilt this back a little bit. And there is a clay blob from once upon a time I gave a wet lab in-person test, which you guys will not have. But this clay blob had a little pin coming out of it with number 5 on it, maybe. And again, there's a circular smooth facet right there and another one right here. So those are the facets of the inferior articular processes. Facets of the inferior articular processes. Okay, are we good with that? Also, if I put it in this type view, it maybe back off a little bit here. Oops. Okay, if I back out a little bit, it's got that jet plane look to it. See how the transverse processes are sweeping backwards? This is the front up here, this is the back. So this is the inferior or an I to S view. We can see the neuroforamen right here. And we can see, what's this? This region right here. That's pedicle. Okay, that's the pedicle. We can also see those demifacets, the inferior costal demifacets here as well. All right, transverse process would be here. Or I'm sorry, spinous process would be here. Transverse process, vertebral body. Specifically, this is the inferior bony end plate, right? It would have a cartilaginous end plate, but that was destroyed in the preparation of this thing. All right, so that's kind of the deal with that typical vertebrae. Let me walk over here and grab another one and see what you think of this one. We'll talk about this more in class tomorrow, but this is always pretty interesting looking. If you like bones, I like bones, so I think it's interesting. So what do you make of this thing? I'll give you a, from the top, S to I view. Anybody see anything weird with that one? Where's the transverse processes? Right? Here's an overhead view of the lumbar. Yeah, it's got and this one we already looked at. These transverse processes are swept back, but where are they? These are the articular facets here, the superarticular facets. So that's the deal with only one vertebrae looks like that. That's T12. So if we spin it to the side, let's see if I can get the tiger stripes to, I can see focus. I think it's in focus. Yeah, so, and another thing, where's the inferior costal, the demifacet? The costal demifacet, it's gone. We see a big one here, and that one's a little weird because it's almost back in the pedicle. This is the pedicle right here. So this can only be T12. And where's the transverse process? Can you see that little nub right there? That little nub is the transverse process. Let me put it more like this angle. See it right there? That's it. Should be sticking way out here, right? But no. So that's really easy. It's also got some little mammillary processes on the back here. A pretty good one. So how do I know this is an L1? Because of that, right there. Let's try to zoom in on that, see if you can see it better. See it? That's a demifacet. Or no, it's not a demifacet. Right? There has to be two of them for it to be a demifacet. That's for the T12 rib. So that is just called a Fullcostal facet. Okay. All right. So let's get into the ribs now. Back off a little bit. All right, so the first question I asked you, let's let it lay there. First thing we want to find out, where's the angle of the rib? Anybody have an idea where the angle of the rib is? Well, it's where it bends the most. So this is the angle right here, from here to here. That's the angle of the rib. Yeah, and notice, well, the next question is, where's the front and where's the back? The angle of the rib is always toward the back. So this is the back of the rib. This is what connects to the vertebrae right here. This is what connects to the costal cartilage, which connects to either the sternum, to the sternum, to the costal cartilage. Or the costal margin. I was thinking costal margin, because not all the ribs connect directly to the other sternum, right? Some connect to a costal margin, which we talked. Did we talk about? Yeah, we talked about that. If not, we'll talk about that tomorrow. All right, so let's zoom in and let's look at this kind of posterior. Or before I do that, which way's up and which way's down? Is this rib in the anatomical position? So this is subtle, but you always look for this right here. See this little mountain range? Let me zoom in on that. Right, see the mountain range right there? Goes all the way around. Oops, one, I got a frame there. Yeah, but there's a little mountain range right there. See, I got a second camera going too, just in case. I think I can see, yeah, you can see it pretty good. You can see the shadow right here. That's called the Costal Groove. So that's where the nerve artery and vein, the intercostal nerve artery and vein run in there. So that always points down. So the anatomical position is, we're in pretty much the anatomical position. This is down. Let me back out here. Right, so the vertebrae would kind of sit like that. I'll use T12, it doesn't really connect, but it kind of will work for us. So it would kind of sit like that. There's the posterior part of the rib. There's the angle of the rib. What's the shaft of the rib when your worksheet terms? This whole thing is the shaft of the rib. Shaft of the rib. Up here it would connect to the costal cartilage. Okay, so now let's focus on this area here. So this is the most posterior part of the rib. Posterior part of the rib, when they say you got a posterior rib fracture, it means it's fractured back here, usually at the, usually around the angle or so. And this is kind of the lateral rib. This is more the anterior part of the rib here. It's another way to break that down. All right, let's take a look at this now. I'm going to flip this upside down because here's the costal groove right here. So let's take a closer look at this. Now we're upside down. Let me zoom in. Okay, looks like it's pretty much in focus. So we have two parts here, three parts actually. We have a rib head. So this is the head of the rib. This is the neck of the rib. It's actually a very short neck in this one. And then see that bump right there? That tells us we are on the tubercle of the rib. Right? So head, neck, tubercle of the rib. The tubercle of the rib has a facet on it. They look like they drilled a hole in it. But this would be a facet right here. That connects to the costal, to the transverse, transverse tubercle. Transverse costal tubercle. That's what that connects to. All right. The ligaments that you see in your worksheet will connect to this neck region. And then this part out here, this is a little hard to see. I don't know if it's going to get this in focus. This is probably the best one that we have. But inferior, by the way, inferior, I can see the costal groove here. So this is inferior right here. So this would be, there's two facets on the head of the rib. They have little holes drilled. This would be the inferior facet of the rib head, superior facet of the rib head, and then we have this line down the middle called the crest of the rib head. I usually use pictures for that because it just doesn't, it's pretty hard to see, right? Let's see, I have another rib here. Let's see if this one can do any better. This one has a much bigger tubercle. If we take a look at that. See how that sticks out? This one's even better to look at. And we're upside down because I can see the costal groove right here. See the groove? If you looked on the other side, it's completely smooth. See if I can get that in focus. Completely smooth there. There's no groove, but on this side it has a nice groove. All right, but let's go back to the head of the rib. Okay, let's see. So we have head, we have neck region, and then see the big bump? So that's the tubercle. Let's see if we got a facet here. This is a lot better. Let's see if the camera will get in focus. Looks like it did. I hope it did. Oops. If you can see there or not, but there's a nice facet. And that matches the costal transverse facet. You can also see the neck, how skinny the neck is. And then you can also see, let's take a look at the head of the rib. See, this one's pretty tough to, it's pretty tough to see. But this is the inferior facet of the head. This would be the superior facet of the head. And then the crest would be in between. You really can't see it. You can really see that. I don't know if it's getting in focus or not. But you can see that tubercle quite nicely. All right, so that's the deal with ribs. Now we don't have any live specimens or cadaver specimens. Let me go grab. So here's what I use in the lab, just kind of teaching aids, because I just want to go over these ligaments and then we'll call it a day. All right. Let me back up and see. All right. So this is, we're looking at this, oops, I pushed all my bones away. We're looking at this view, kind of an oblique A to P view with an oblique twist to it. You can see the transverse costal facet there nicely on that one. But now you can't here because ribs are covering the transverse processes, except for this one. This rib has been removed. And you can see the costal transverse facet, really nice there. And you can see the superior costal demifacet. Remember, superior names the rib. All right, and so we have one rib, one ligament here which kind of holds the rib to the vertebral body called the radiate ligament. It's right there. And then we have, in this view, this A to P view, you can only really see one ligament. The other ones we have to look over the top to see. And there's 3 costal transverse ligaments that we have to deal with. And the naming is terrible on these things. There is a costal transverse ligament, just no adjective in front of it. Then there's a lateral costal transverse ligament. And then there's a superior costal transverse ligament. The superior costal transverse ligament, that's the only one that courses courses the 2 different motion segment members. So let's look at the superior costal transverse ligament. It arises from the neck of the rib, which I showed you on the back side, so we can't really see it. And then it courses to the front part of the transverse process, which is behind this rib. So it would attach, oh, you can see it right here. See how it attaches to the inferior? And it goes up about halfway, some of the research says. So that's the superior. That's a view of the superior costal transverse ligament, and that's a view of the superior costal transverse ligament there. Some authors are convinced that there's an anterior fibers and posterior fibers. The anterior fibers run more obliquely, kind of toward the lateral direction, and the inner fibers or the inner leaf, whatever you want to call it, it runs more obliquely toward the midline. Kramer doesn't talk about that, so I'm not worried about that. We're just going to leave it at those 3 ligaments. Now you can see, kind of Photoshop this in. This would be the lateral costal, or the lateral costal transverse ligament, kind of flapping in the wind. Where's the lateral costal transverse ligament on this image? Well, it's hiding behind here. It's underneath. It would be right here, but it's behind the rib, so we can't see it. It comes off the lateral margin of the transverse process there. But if we go to an overhead view, let's do that now. Take a look at this. If we go to this overhead view, we can actually see it. Now the lateral and the lateral costal transverse ligament and the no-name costal transverse ligament, they can only be, they only run between the same motion segment, or between one vertebrae. So if this is an overhead view, and so if this is, let's say this is, how about T7? I can't write my thing, my pencil's broken. But if this is T7, this is also the T7 rib, because these two are joined together. And notice how the lateral costal transverse ligament connects to the lateral part of the transverse process. It connects into that tubercle of the rib, specifically into kind of the unfacet part, right? There's a facet. Remember, on the tubercle has a facet which connects to the transverse costal tubercle. Just a little bit kind of lateral to that, there's a rough area, and that's where this lateral costal transverse ligament connects. Okay? And then here's the neck of the rib. Here, that's where the unnamed, just the costal transverse ligament with no adjective in front of it. Costal transverse ligament, what a horrible name. It connects between that neck, and it also goes into the front of the transverse process. All right, so those are the ligaments. And let's see, did I miss anything? I don't think I did. So I guess that's about it. Let me walk back over here so I can get in focus to see if you have any questions. Actually, I can show you my little setup here. You can kind of see my other camera right there. And there's my laptop. And, yep. So, if we don't have any questions, last thing I see is Hunter saying, yep. Yeah, so any questions? Or are you guys good to go? Are you even still there?